It is another exciting edition of your favorite program, Health Affair on AIT, a program where we focus on public health challenges with a view to finding lasting solutions. I am your host, Oshuomo Daniels, and you are welcome. Today we shall be focusing on cancer and how to win the battle against the silent killer of people globally, a disease that has no regard for age, tribe, or status. First, let's bring you reports of recent happenings in the health sector across the world.
The U.S. Agency for International Development, USAID, has provided critical commodities to Nigeria's National Tuberculosis, TB, and Leprosy Control Program for the testing and diagnosis of more than 10,000 patients suspected of having the disease. The donation of 86,500 Gene Expert Ultra cartridges will help Nigerian health workers to optimize the use of molecular diagnosis tools that can detect both drug-sensitive and drug-resistant forms of TB and improve detection of TB in people living with HIV and AIDS. According to USAID mission, Nigeria has the highest estimated burden of TB in all Africa. With these cartridges, officials tasked with reducing its burden in Nigeria can identify some of the most problematic strains of the TB bacteria. TB can be spread from person to person through the air when a person with active TB infection coughs, sneezes, speaks, or sings. Symptoms include coughing up blood and chest pain, as well as weight loss, night sweats, fever, chills, and fatigue. Early detection and treatment of TB will stop transmission of infection and move the country closer to ending the TB epidemic. The Ministry of Health of the Democratic Republic of Congo has announced a new case of Ebola in Butembo, a city in North Kivu province where a previous outbreak was declared in June 2020. The Butembo branch of the National Institute of Biomedical Research (INRB) confirmed Ebola in samples taken from a patient with Ebola-like symptoms who had sought treatment at the local health center. The woman, who was the wife of an Ebola survivor, has since died. The World Health Organization is providing support to local and national health authorities to quickly trace, identify, and treat the contact to curtail the further spread of the virus. Already, more than 70 contacts have been identified. Disinfection of sites visited by patients is also ongoing. DR Congo has recorded about 3,481 cases, 2,299 deaths, and 1,162 survivors since first outbreak. The alleged removal of Nigeria from the list of countries to take the Pfizer vaccine did not come as a surprise to many, as some industry watchers believe that Nigeria leaders have not shown enough commitment towards management of the pandemic. Nigeria had announced that the country was ready to receive 100,000 doses of the COVID-19 vaccine on or before February 2021, before the allegations that the World Health Organization (WHO) excluded the country from the list.
You lose the conditions for storage, they just turn to like ordinary water, so they are no longer going to be of any effect. You cannot blame WHO. The whole world, we all know that the vaccines are in high demand. So why do you take it to a place where they will not be able to keep it? So it's staring us in the face. And it's another way of telling us that yes, this country is failing, cannot provide properly guaranteed cold chain.
I remember vividly on the 6th of February 2021, a WHO representative on his Twitter handle did say that they don't have the authority to exclude member states. If COVID is affecting the whole world, why would Nigeria be excluded from a vaccination?
Coming at a time when there is much safety concerns about the vaccine and how to achieve fairness in prioritizing those to take the vaccine first, the expert says leaves much to be done by the relevant authorities.
Some of the numbers that we see being rolled out give us a lot of cause for alarm. For example, there was a document that was published, it cannot be confirmed, but somebody said, for example, they want to vaccinate 2,000 healthcare workers in Lagos State. So your mind starts going, who are these 2,000? Because even if you take the number of doctors alone and not include all the nurses, not include other members of the team that also work in health, then you know you're not getting the numbers that are expected. So we feel that something drastic needs to be done.
That the Western one says it's 99% or 98% effective does not mean that it is for us, because we don't have the same climate, we don't have the same body mechanism. So I feel our scientists would also have to do their research on the vaccination.
We should still go back to the preventive measures.
Thursday, 4th February 2021 was World Cancer Day. Another opportunity to create awareness about the disease and chart a way forward in terms of prevention, early detection, and treatment. According to reports by the World Health Organization, WHO, 12.5% of all deaths are attributed to cancer-related diseases, a trend they say has the potential to trigger more than 60 million new cases annually. To change this narrative, I bring to you a cross-section of experts who spoke extensively about the causes of cancer, treatment, and impact of COVID-19 pandemic on cancer care in Nigeria.
Cancer is any abnormal growth in any part of the body, and then there are over 100 types of cancer. Cancer can develop from the scalp to the toes, so any part of the body can become cancerous. Talking about causes of cancer, more often than not, we don't have any identifiable cause. So we usually talk more of predisposing factors. There are some cancers are able to talk about what is causing them, but in most cases we don't know what the main cause is. So we talk about predisposing factors. A major one is age. It's commoner among the elderly. Only that in recent time we now see some cancers in some younger age group. Another thing that can be a major cause of cancer is smoking and alcohol intake. 80 to 90% of cancers are being linked to that. Human papilloma virus infection is linked to so many cancers, head and neck, cervical cancers, and then this is a sexually transmitted disease. Hepatitis B virus has been linked to liver cancer. Then other viruses, there is HSV, and there are other infections like schistosomiasis. We used to call it jiga in Yoruba. People that wade in water or live around water. There's liver fluke and so many other infections that have been linked to cancer. Then obesity is also connected to cancer. Like so many female cancer, ovarian cancer, endometrial cancer, even breast cancer have been linked to obesity. Then our foods and diets can also be a culprit. Another major thing I want to talk about is family history, environmental pollution generally.
It's the second most lethal disease, second most lethal chronic disease, only second to hypertension worldwide. 70% of cancer cases are now in low and medium country, in which Nigeria is one of them. And we know the mortality is more high in the low and medium countries than in the Western countries, because the Western countries, they now have the technology to be able to handle it, and they've educated their populace so that they do screening and they detect it early and they're able to also manage it. They've not only been able to educate their populace to come for screening, they've also been able to train professionals. They've equipped their hospitals, and they've also made their patients paid via insurance scheme, because cancer treatment is very expensive. And even if you diagnose it early and you come to the clinic early, if you are paying from pocket, that may create a lot of obstacle to treatment. In our country, most of our cancer cases, they present in stage 3 and stage 4. Over 80%. 80% of our patients comes in stage 3 and stage 4. And anywhere in the world, if you come in stage 3 and stage 4, if you present as stage 3 and stage 4, it's not you can't get curative treatment. So over 80% of our patients that present will die of cancer. The mortality is very high, not just because we lack the facilities, but also because of late presentation and the payment mode. So we need to correct all this if we want to actually make an impact in survival rate of our cancer patients.
To treat cancer, we have different modalities. And the modalities basically are, one, we have surgery, which is removal of wherever the primary disease is, wherever you find it, which is surgery. And after that, you have to do chemotherapy, which is combination of drugs, which you use anti-cancer drugs, to mop up and reduce the burden of the cancer cells in the body. And then we also have radiotherapy. Radiotherapy is using ionizing radiation, equipments that we have to be able to kill off the cancer cells. When you're treating, there are times, because in this part of the world, over 70% of our patients coming in advanced stage, we find out that most times what you can start off with is the chemotherapy. The essence of starting off with the chemotherapy is try to shrink the tumor, the mass, so that after shrinking, you now review if it's amenable to surgery, where you can still debulk or remove part of it, because the more of the cancer cells you remove from the primary site, the better the chances of the treatment outcome and the outcome for the patient. In those treatments, the truth about it is that it's very expensive. Just like Dr. Abib has said, the mortality in Nigeria, we talk of cancer, we see about, in 2018, the statistics said that we saw about 10 million cases of cancer, and the death was about 9 million. So, and it is said, you know, at times when you say these statistics, it's like, what does it really mean? You can say we are 200 million, but it's been said by the UICC and by the WHO, the World Health Organization, and the Union for International, Cancer Control, that 1 in every 5 person globally will develop cancer, while 1 in every 8 men and 1 in every 11 women will die of cancer. Cancer treatment is expensive, and minimally to treat cancer, you should have at least about 2 million or more, depending on it. So that's why we're using also this media to appeal that, people should come early. When it's early, it's easier, and also using this media to appeal that the government should help so that there could be a well-structured insurance, health insurance scheme where people can key in and have access to treatment so that we can reduce the mortality. The World Health Organization is striving towards a cancer-free world. I'm sure some will say, can it be, attained? Yes, we can. We all need to work together as one, to be able to achieve that. Breast is the commonest cancer in women, followed by cervical cancer. And then, for the men, we have prostate cancer. We have leukemia, which is the blood system. And then we have, ovarian gynecological cancers, which is either ovary, endometrium. I'm talking of the common. We have childhood cancers, too, that are seen. But one thing that is key is that when you have a symptom, or your children have a symptom, if you go to a particular doctor the first time, right, and the symptom after treatment persists 1 month, 2 months, 3 months, it's important that you probably change your doctor for, a second opinion.
Their immunity is compromised. The probability that they will be affected with COVID is higher. And so, for us, we still have to see the patients. We're always at work. We never had a downtime. But we had rules that govern how we attend to the patients by maintaining social distancing, ensuring that we wash our hands frequently, ensuring that we use our face mask, our face shields. And so in that way, we're able to see them, we're able to manage them as we should. And we also restrict the way they enter into the centers, such that we don't have a high number of people at the same time in the centers. The COVID-19 has made us to restructure the way we run our clinics. It has made us to restructure how we attend to patients.
I wish to advise that one of the best things you can do for yourself every Wednesday at 9:30 a.m. is to tune on to AIT and watch the health affair. You will never regret it.
Next on the show is our nutrition segment, and the focus today is on grape.
Grape is a fruit, and botanically a berry. Grapes can be eaten fresh as table grapes, or they can be used for making wine, jam, raisins, grape juice, and jelly. The seeds can be used for vinegar and grapeseed oil. Archaeological evidence suggests humans began growing grapes as early as 6,500 BC. The world produces about 7.2 trillion gallons of wine each year, making it by far the most prevalent use of grapes. This value represents a 35% increase since the mid-20th century. Europe, especially in Italy, France, Spain, and Russia, account for 80% of total world production. Fresh table grapes account for less than 12% of the world's total grape production. Since fresh grapes are highly perishable and transportation costs high, fresh grapes are consumed primarily in the country of their production. Grapes are classified into different varieties, such as native grapes, European grapes, French-American hybrids, and Muscadine grapes. Grapes are packed with nutrients, especially vitamin C and K. 1 cup, that is 151 grams of red or green grapes, contains 104 calories, 27.3 grams of carbohydrates, 1.1 grams of protein, 0.2 grams of fat, 1.4 grams of fiber, 27% of vitamin C, vitamin K, 28% of the recommended daily value, thiamine, 7% of the recommended daily value, riboflavin, 6% of the recommended daily value, vitamin B, 6%, potassium, 8%, copper, 10%, magnesium, 5%. High antioxidant contents of grapes help prevent chronic diseases.
Welcome back. The COVID-19 pandemic has taught us a lot about how to do certain things as first aid before the arrival of a medical personnel. To this end, I bring you tips about vital medical instruments and how they can be of help to you.
An incubator is designed to provide a safe, controlled space for infants to live while their vital organs develop. An incubator provides an environment that can be adjusted to provide the ideal temperature as well as perfect amount of oxygen, humidity, and light. Incubators are used in combination with other equipment to ensure that babies needing extra support after birth have the best possible environment for continued monitoring.
Next on the show is our clinical segment.
The mask must be up to the bridge of your nose here, okay, and then down to cover your chin. Okay, so you see a lot of people with beards, putting mask above their beard. You don't do that. And then anytime you need to take off the mask, you take it off totally. Not as if you hang it by one ear, or you make it as a face mask, or you wear it on your elbow, or all these other things, okay? All those things don't help. it's not just about wearing the mask. They must be worn consistently, they must be worn properly, and they must be removed properly. Whether you're trying to protect yourself or other people, there is only one way the mask works, and that is that the lighter part, the lighter colored part, which is usually white, should be inside, and the colored part, which can be blue or green, must be outside. The way it works is that that lighter part, the white part, is the one that absorbs your own secretions as it's coming out, and while the colored part prevents the secretions from outside from coming in, and that's the way it works. Once you reverse it, you actually reverse the whole principle of the mask, and then the mask is not working again.
Please call the numbers showing on your screen. Your opinion counts on how we can improve the health sector on our perception segment.
Effective use of face masks or non-use at all. So what do we expect? This is the result that we are seeing. Government is trying, but the truth of the matter is our own part of the bargain. We are not doing it. I'm not aware whether it is Governor Sanwo-Olu or President Buhari that is going to wear face masks for everybody. Those are areas that we need to, and the press need to actually really, it is, look, people, they say that experience is the best teacher. But I can assure you that COVID-19 is better imagined than experience. We need to get that across. Up till now, people still talk about COVID-19 being a scam. I don't really know how are you going to convince such people? I've had somebody who told me that until he sees the dead bodies on the road, are we going to get to that level? Is it that they don't watch TV? Don't they see what they happen in America? America that is top-notch in terms of facilities. Did they think we can go with that kind of situation? I don't really know if this, it's a scam. It's a scam in Nigeria. It's a scam in US. It's a scam in UK. UK is locked down now because of COVID. Come on. I think our people need to be responsible. We have to be responsible.
I hope you have benefited much from the program today. Please join us again next week at 9:30 a.m. My name is Oshuomowa Daniels. Your health is your wealth. Please pay attention to it.